Welcome to No Filter Doctor, where we cut through the health hype and dig into what's real, what works, and what's backed by evidence. I'm Dr. AK. Let's get into it. Hello, everyone. Welcome back. We're going to talk about something very popular right now, and it is GLP-1 weight loss medications. I was inspired to discuss this topic based on a bunch of different reasons. The first one is it is everywhere, all over the internet, all over social media. Everywhere you look, you see these GLP-1 medications. And I can completely understand why. They look like an amazing weight loss medication. And, weight loss is something that many people in the country desire. So it makes perfect sense. But it also opens the door wide open to a bunch of other companies and industries to kind of creep in here and make money off of people. So what started out as going and seeing your doctor and getting a prescription for your diabetes or your weight loss has now turned into online memberships with different companies, a lot of whom are backed by private equity, not medical organizations. You ask a couple questions, some of which you can absolutely lie about, and then you get a compounded formulation of some of these medications sent to your home. I try and be as unbiased as possible when I'm doing this podcast, but that, quite frankly, is super sketch. And I'm not knocking all compound pharmacies. Some of them are verified and they are very honest, and what they're sending you is exactly what they're saying that they're sending you. Some of them, not so much. And when you have all these different options to choose from, it's really hard to vet out who is legit and who is not. So again, that's one reason why I wanted to talk about this. Another reason why is because I was just flat out asked to talk about this. Now, somebody that I work with came up to me and was like, I really love your podcast and I want you to talk about GLP-1s. I'm not going to say who the person is, but you know who you are. And so here's the podcast that you requested, and I hope you enjoy it. Some of the main things that I do want to talk about are what do these medications do? Who can and who cannot be on them? And then all of the other things that you kind of need to know to be on these meds. So if you are someone who went and got them online, I do not fault you at all. I think you did what you thought was the best for you. But I also know, depending on which company you went to, there is no one around for you to have a discussion with regarding some of these medications. And quite frankly, you are the people that I am most concerned about, because I think you just need to know a little bit more about them. And then once you hear this, maybe you can go have a conversation with your doctor and decide, is this the route I want to be on? And for some of you who aren't on them, maybe when you hear about this, it'll lead to a discussion where you're like, you know what, I did not know that about these meds and they kind of sound right. So hopefully it will clear the air for some of the questions that are out there. The first thing we need to discuss is what are these GLP-1 medications? And in order to do that, we have to talk about normal physiology. GLP-1 stands for glucagon-like peptide 1. And this is a hormone that is naturally secreted from intestinal cells in response to eating foods that have glucose or fat. So we have this hormone naturally occurring in our body. In response to eating, GLP-1 stimulates insulin secretion. It suppresses glucagon release. Now, glucagon is another hormone that we have, which actually helps increase our blood glucose. When we eat glucose, the excess carbohydrate is stored in our liver in a form called glycogen. And glucagon tells the liver, hey, I need some sugar. Can you release that? So the GLP-1 hormone suppresses that from happening as well. It does a couple other things too. It also slows down gastric emptying. So you've eaten food, GLP-1 gets released, and then it tells your whole GI system, I need you to slow down, take your time, and kind of digest all of these things so that the nutrients I need and the water that I need gets absorbed. And the last thing it does is send signals to your brain to tell your brain, hey, turn off the hungry. Make this person not hungry anymore. So between the insulin secretion, suppressing glucagon, slowing down your GI tract, and telling your brain to turn off the hunger, all of these collectively result in reduced food intake. That's the natural state of what our body does. Now, the GLP-1 medications they're called GLP-1 agonists, which mean they are medications that basically mimic this hormone that our body naturally releases. So rather than eating something and then having all of these things happen, you take this medicine exogenously through an injection. Most of the time, there are a couple oral preparations that the pharmaceutical companies are working on. But for the most part right now, you do the injection, and then you have this exogenous GLP-1 agonist floating around in your body. So all of those things happen when you inject this. The insulin increases, glucagon goes down. That's how it helps with diabetes. The GI tract slows down and your appetite decreases. That helps with decreasing your caloric intake. So now you have a caloric deficit without even eating anything, and that's what leads to this profound weight loss. There are plenty of medications that are out on the market that you can take that can suppress your appetite and that can lead to this caloric reduction and weight loss. However, you can't really be on them for a long period of time. Some of them are forms of amphetamine, which can just kill you. It's not good for your heart. And some people are just not candidates for those medications either. So these GLP-1 agonists have really opened up options for a lot more people than what a lot of the other standard medications that have been around for a while have been doing in terms of weight loss. When we're talking about the GLP-1 medications, there are two different kinds. There is semaglutide. They go by the brand name Ozempic and Wegovy, and then Rybelsus is the oral formulation of that. So Ozempic and Wegovy are injections once a week. Rybelsus is a pill. And then the other form of a GLP-1 agonist is tirzepatide. And the brand names for that are Mounjaro or Zepbound. I have a link to the blog in the show notes. And if you click on it, there's a little chart in the blog where I kind of drew out what naturally happens and then where these medications come in play. For those visual learners that are out there, this will be something that you can look at just in case it's still not quite hitting how these medications work. In terms of who should and who should not be on these medications, we have to look at a couple things, right? So there are the FDA indications. And depending on which one of these you're looking at, the FDA indications are different. While yes, they are all GLP-1s, the testing that was done on them in order to gain FDA approval is different. For example, both Ozempic and Wegovy are semaglutide medications. Ozempic does not have an FDA indication for obesity, but Wegovy does. And that has to do with the testing that was done on the medications in order to get the FDA approval. And similar with the tirzepatides, Mounjaro doesn't have any indication for weight loss, but Zepbound does. And recently, Zepbound got an additional FDA approval for the treatment of moderate to severe obstructive sleep apnea. In addition to FDA indications, there are also contraindications and cautions to the use of these medications. Anyone who has had or has a family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2, they cannot be on these medications. Obviously, if you've had allergic reaction to them, you cannot be on them. It's also relatively contraindicated in patients who have really bad gastroparesis. So let's talk about that for a second. Gastroparesis is a condition where your GI tract is very delayed in digesting foods. If you go back, one of the things that I said GLP-1 does is it slows down the digestion of your food. So if you have gastroparesis and then you go on a GLP-1, there is potential for a very bad outcome with severe abdominal pain and nonstop throwing up. Gastroparesis is just one example. There are other contraindications and concerns as well, such as recurrent ileus, bowel obstruction, people who have a history of pancreatitis or really bad gallbladder disease, and diabetic retinopathy and kidney disease. So again, medications are not for everyone. And that's why it's really important that when you are going to some of these online companies, that you make sure you're talking to someone who knows all of these things and who's asking the right questions. Full disclosure, I like these meds. So I know I'm talking about them and I'm giving some caution about them, but these meds have actually been life-changing for some of my patients. But I will tell you that I approach them a totally different way than some of the other people who are out there prescribing them do. First of all, I want some baseline data and testing before we even go down this road of a GLP-1 medication. I get a set of vital signs on all my patients, along with a body composition scan and some blood work. And yes, it is true that you don't necessarily need these, but I find them very valuable for several reasons. First of all, I want to know, is there anything going on that would prohibit or warrant caution with the use of any of these medications? I have plenty of women who are ovulating, and I want to know if they're pregnant before I put them on these meds, because these medications are not approved in pregnancy or breastfeeding patients. So I think it's really important that we know that ahead of time. I want to know, are there kidney conditions? I also want to know, are there any other conditions that somebody might have that will actually help me get this medication approved? I'm telling you, one of my least favorite things is this battle of pre-authorizations with insurance companies. I literally have patients who meet the criteria for gastric bypass surgery, and their insurance company is giving me a hard time about putting them on the lowest dose of a GLP-1 agonist. So as much data as I can have going into that battle really helps the chances of me getting that medication approved by someone's insurance company. Body composition is really important because when we lose weight, any kind of weight, no matter what kind of diet you're on, if you are losing weight, you are going to lose some amount of skeletal muscle mass. It is inevitable. But when I get a body composition ahead of time, I can put together a nutrition plan for a patient, and I can try and minimize that skeletal muscle mass loss significantly. So these are the reasons why I like to get labs. I like to get the body composition. I want to know BMIs. I want to know all of this information to just really help me get the medication approved, put together some kind of movement/exercise plan, and to calculate the nutritional macros that I want my patients to be on to prevent as much skeletal muscle mass loss in this weight loss journey. The other thing that I like to do in these appointments is discuss lifestyle modifications because they still matter. Okay, before I get into that, let me first kind of back up a little bit and talk about why this matters. I know there are going to be doctors out there who prescribe these medications and don't agree with me, and that's okay. You're allowed to not agree with me. This is my opinion based on the data that I have read. There are basically two populations of individuals who are going to be on GLP-1s for weight loss. The one group are the people who are going to be on these for life, whether that's microdosing or whatever dose they're at. They metabolically require these medications in order to maintain the ideal metabolic health that they need so that they can have a nice, healthy life. The other group of people are the individuals who can make lifestyle modifications and have these become a new way that they live and a new way that they do things, where they may eventually be able to come off of these medications. I'm not really certain that there is a way to tease out between these two groups of people in the very beginning. So I have a conversation regarding lifestyle modifications with all of my patients. They all get a movement plan. They all get a nutritional plan, and we do things in baby steps, right? The goal is to make these the new normal. And you can't make things the new normal if you do a complete 180. Like, I'm not looking to flip a table here. We take baby steps and we do it through lifestyle modifications, and everybody does it. And what do these discussions look like? So if we're talking about nutrition and caloric intake, well, the medications are already going to reduce the caloric intake. That's what they do. But the nutrition really matters. And if I want to keep this podcast within a reasonable amount of time, I honestly can't even get into the details of everything that is nutrition related. But bottom line, one of the major things is protein. If you are trying to lose fat and not lose muscle, then protein macros count. The US RDA of 0.8 grams per kilo per day is a joke in this situation with people who are on GLP-1s. So that matters when we talk about nutrition. My goal is to always keep people on the lowest dose as possible. So we talk about exercise because in the math equation of caloric intake minus caloric output, if I can increase that caloric output through exercise, then it helps us keep the doses low for the GLP-1s. And it does matter because there are patients who insurances will not approve these meds, and the lowest dose is actually relatively affordable. But when you go up in these higher doses, it becomes more and more expensive and very financially restrictive. So we talk about exercise. If I want people to have energy to exercise, we talk about sleep because that is important. If I want them to sleep, we have to talk about stress and mindfulness. The other part of the mindfulness is food noise. I have patients who are on GLP-1s. You're on the medications, food noise, gone. You come off the medications, food noise, super loud. There's multiple studies that show mindfulness can help reduce that food noise. So we work on those kinds of things. We also have conversations about alcohol consumption because there is a significant number of calories that are coming in through alcohol, there's no nutritional benefit there. These are literally just empty calories. And when I counsel people on this, it's like an epiphany when they realize how many calories they're consuming is from alcohol alone. And the last thing, I shouldn't say the last thing, one of the other things that we talk about are social connections. Like, who do they have on this journey with them who can support them in addition to me, right? I'm their doctor, I'm there, they have access to me, and I'm always going to be there. But I'm not necessarily going to be there when they're making food choices at a restaurant. So who else is there to be on this journey? Again, it supports success. So lifestyle modifications really matter, and you don't necessarily get this coaching when you're just getting these medications from some random private equity online company where they require you to fill out a couple questions, don't really look into the details of things, and then you end up with something compounded from who knows what pharmacy. It's so shady, it's so scary. And bad things can happen with these medications. Bad things can happen with any medication, but specifically with these GLP-1 agonists, you can get a ton of GI distress, like bad nausea, bad vomiting, bad diarrhea. Most of the time it occurs when you're escalating doses and you're going up in a higher dose. And these are the patients that I often see in the emergency department. I'll look at their med lists and I see that they're on a GLP-1 agonist. And I'm always like, did you just go up in dose? And 9 times out of 10, they're like, yeah, I did. Other things that can happen are pancreatitis, gallbladder disease, uncontrollable drops in the sugar, worsening of diabetic retinopathy. GERD gets pretty bad. You can get an acute kidney injury from dehydration. And then obviously you can develop allergic reactions, but that's not necessarily just GLP-1 things. That's all meds. These are not necessarily all benign conditions, and people should have access to someone that they can reach in a timely fashion who is prescribing these medications to them to be like, yo, I'm having these symptoms. Do I need to worry? Some of the online companies have this, some do not. So you have to look into that ahead of time before you start dumping money into it. One of the main things that is really the most frustrating, and I made mention of this a little bit earlier, is just how expensive these medications are and getting people access to them. Like, we've talked about how I really do not like the energy of big pharma. The only thing I like about them is the fact that they have to go under FDA approval for things, and then they're under a microscope. So you know whatever they're producing is what they're producing. But they make these outrageous prices that most people cannot get to, which then opens the door to compounding pharmacies. And I said it, this can be scary. In fact, the FDA even issued warnings. Like, I've had people be like, why do you hate compounding pharmacies so much? I don't hate compounding pharmacies so much. I hate shadiness and I hate greediness. And those two things have created certain compounding pharmacies that absolutely fall in those categories, to the point where the FDA issued a warning about compounding pharmacies selling incorrect formulations, contaminated products. Some of them are selling these things called semaglutide salts, which are not even close to the actual FDA-approved drugs. And so these are the things that I always get concerned about, and I really worry about patients because of the shenanigans of these different companies that are out there. All right, I got to dial it back. I'm getting a little ranty. You can see where, my emotions really kind of peak on this topic. The bottom line is that GLP-1s are good medications. They work. I like them. I'm a fan of prescribing them. I'm not a fan of prescribing them blindly to people without having data, such as body composition, blood work, knowing their vital signs. I'm not a fan of people being on these medications and not being under the direct care of somebody because, as we discussed, bad things can happen. And I'm definitely not a fan of predatory companies that are taking advantage of patients who really need medical help. If you're considering these medications, I would first have a conversation with your doctor. Go through your health record. Maybe you have some underlying conditions that are FDA approved. You may have an FDA indication for these drugs. While that doesn't guarantee that your insurance will approve it, it does help. So I would say that's the first step. This is what I do with my patients. And you know what? Sometimes they don't get approved. Actually, more often than not, they don't get approved, which is super frustrating. But then I just go through Lilly Direct, and I am not getting any kickbacks from Eli Lilly. The reason I go through Lilly Direct is the price point for the lowest dose of Zepbound is very affordable to a lot of my patients. I send a prescription directly to them. The patients directly pay them. And then the medications get delivered to their house where they can use them. So it's just easy. Nobody's getting any kickbacks. It's dealing with the pharmaceutical company directly because a lot of the retail pharmacies will add on so much money to the cost of these medications. So we've basically just eliminated them. And while I super duper want you to be under the direct care of your doctor or whatever member of your healthcare team, I know that's not an option for everyone. So maybe you do need to go down this online route to get these medications. I'm not going to judge you, right? We all have different situations that we're in. Finances are different for everybody. All I'm going to ask is that you please do a little bit of homework before you just jump on the bandwagon of one of these online companies. Who owns the company? Are they owned by a group of doctors? Is it some kind of medical group? Is it owned by a private equity company? I think you need to know that because private equity doesn't necessarily pride themselves on patient care and quality, right? They pride themselves on the money that the stockholders get. So you need to look into that. I would also take the time to find out which compounding pharmacies are being used. You can literally Google different compounding pharmacies, and if a big news article comes out about how shady they are, if that's the company that's being used, I would not use that online company, right? So there are different ways to kind of work around this. Some employers are now offering these medications to their employees. So if you feel safe in your employer knowing that you want access to these medications, that may be another route for you. There are options. And again, I like the GLP-1 agonist medications. They're good drugs. I'm not knocking them. I just want to make sure that you have all the tools that you need moving forward to have the discussions with the people who are able to prescribe these so that you are not getting the wool pulled over your eyes and that everything that is happening is safe. Thank you so much for joining me this week on No Filter Doctor. What you do need to keep in mind is that while I am a doctor, I'm not your doctor. So anything that we discuss on this podcast is not medical advice, and listening to this podcast does not establish a doctor-patient relationship. The purpose of this podcast is for information purposes only. Any questions or decisions that you want to make about your healthcare should be discussed with your doctor or other healthcare provider. Making healthcare decisions without discussing it first with your doctor or other healthcare provider is done so at your own risk.